1915I Medicaid Academy. We're going to talk today about an orientation about all of the academy, and then we're also going to go specifically to the first part of your journey in becoming a Medicaid provider, which is always provider enrollment. So welcome everyone. My name is Marcella McGuire. I am going to be one of your primary hosts for and trainers for these sessions. Let's keep going. And while we're switching slides, mention that we are all from Corporation for Supportive Housing. And this is a lovely slide of your incredibly beautiful state. I've been there a couple of times working with you. CSH is a national nonprofit, 29 offices in 13 states, and we'll introduce ourselves in a little bit as well. But I think the first voice we should hear from, aside from setting us up and getting all to the table, is Monica Hagen from the folks at both DHS and behavioral health, the Medicaid part of DHS and the behavioral health part of DHS, who are partners in this process. Monica, why are we here?
We are here because we wanted to offer an opportunity for providers to get some great technical assistance from what I would definitely consider to be the subject matter experts in Medicaid enrollment and just all things Medicaid, which is you all from CSH. We're here because there's kind of been a shift in our state from a lot of general state funds contracts to kind of pulling back on those and incorporating more braided funding, different funding sources and some agencies are looking to expand on their revenue sources, moving away from just maybe grants or the state contracts like I mentioned. So really giving everybody the information they need in order to understand Medicaid and enroll to be a Medicaid provider is really valuable at this point in time. So wanted to give and specifically have to give 1915I a shout out because that's my program that I'm administrator for. So this training is really focused on those providers who will be becoming 1915I providers. And we're looking to, obviously grow our provider base in the state. And I think this is a great way to do that.
All right. Thank you. Thank you. Anything else from you? And when we're so grateful for your support and being a part of this process, many of these questions, Medicaid is very complicated. We will learn that some questions can be easily answered, but most questions have to be depends how you say it, depends how you think about it. And we're going to be working with the state to develop some guidance and, frequently asked questions and answers to those questions as well. So we couldn't be doing this without Monica and Jennifer and her team supporting this. Oh, yeah. All right. So next slide, I think, is our introduction. I was starting to do the introduction. Good to see everybody here. We're going to have all the agencies introduce themselves as well. But to start, I lead CSH's Health and Housing Work nationwide. I've been privileged to work with the great state of North Dakota for the last 4 to 5 years. We focus primarily on the housing aspects, the housing supportive services of your benefit. But now we've been able to really expand that to all of the different services that are covered under the 1915I. This training is going to be mainly about administration. I worked for many years for a behavioral health system. I worked for many years for a managed care organization, and really those details there. So bringing that experience, but every state is different in Medicaid. So it's really important to have part of that conversation as well. And I want to hand it off to my co-trainer, Ambrosia Crown.
Hey, good afternoon, North Dakota. So like Marcella said, my name is Ambrosia Crump. I'm a senior program manager in our national consulting healthcare team. So definitely being deeply embedded in how different states are leveraging benefits, right? And learning how to do that as providers through Medicaid academies across CSH. My background is a provider. I'm an LCSW, worked in outpatient and inpatient behavioral health settings, worked in homeless systems also. So bringing kind of the lens from both perspectives, and hopefully we can do some great things together through this academy.
Thanks, Ambrosia. And I'm so sorry I don't have your picture up here. I don't think I had one of those, but I'm really grateful that we've got the technical support, not my area of expertise. So Hillary, can you introduce yourself as well?
Good afternoon, everyone. Hillary Williams. I am the Eastern Region Operations and Program Coordinator at CSH, providing technical support to this meeting and many others cross-regionally. Happy to have everyone here. If you have any problems with staying online, getting online, registering, upcoming meetings, etc., please reach out. Thank you.
Thanks, Hillary. So appreciate that. So next slide, please. So to start with, we want to see from agencies, where are you located? So let me practice this, see if I know how to do this. Zoom keeps changing things on me, and I just don't adapt well to change sometimes, but this is a lot of changes here. I don't think we still have those pencils anymore. Is that, am I right here?
Now they give you a lot more stuff. I guess if you go to the top and select annotate, which kind of looks like a pencil for most people, then it starts giving you all these. You can do stamps, you can draw, you can do the arrow, but we do want you to feel free to mark up where your organization is located here. So if you go to the top, there should be an annotate, and it should drop down and give you some icons to choose to make some marks. And it'll start showing your name.
Oh, see, somebody's
Yeah, it's
getting
working.
this. So where in this beautiful state of North Dakota are you? Right. I'm going to take my arrow and put it east of here because I am based out of Philly. Further east. I didn't want to put it in Minnesota. All right. So Lisa said they're offering services in a couple of different locations. So just pick one for your arrow. Awesome. All right. So we've got folks over the state. We've got folks in Bismarck and Burleigh County. We've got folks in Fargo and the East, etc. Just more than a few places. There we go. All right. And if the arrow isn't working for you, or this is too much tech, please tell us something in the chat as well, where you're from. This is in Bismarck. Thank you. All right. So as you see, one of the state's goals is really to grow the provider network in regard to this service. So we are really excited to see arrows in many different places. We will be, thanks, Leanne, we will be, as I said, this is all going on the recording, so this will be all information to the state. Oh, Solutions is in Bismarck and in Fargo. Thank you for that, Carolyn. So part of that conversation, so thank you. And Tanya's and the folks at Native Inc. are in Bismarck. There we go. Welcome to Williston Council for the Aging. Oh, AAA's, love you guys getting involved in this work. Thank you, thank you. Next slide, please. So what is the Academy? The Academy is really a focus on the administrative aspects of Medicaid. There is lots of training and support that you and your agencies may need on, next slide. Oh, sorry, I forgot about this one. No, you're good. All right, before we begin, this is a good one. Before I get onto that piece, tell us in the chat where your agency is in the Medicaid process. You haven't enrolled as a provider at all. That's the first option. You've started, but you haven't submitted the agency application to enroll. You've submitted it. You're waiting to hear back from Meridian. You've been asked to make revisions, or you're actually approved to provide services under the I. Would love to hear that. Haven't started? Good. We've got some submissions, started, not submitted. Yep, it's a complicated process. Native Inc.'s approved to provide services. Congrats for that. Congrats for everybody who started, not submitted, because we want to hear where the agencies are, and we want to make sure that in part of this dialogue and conversation, we're also talking with you about what's needed. You know, we're talking it at a way that makes sense. If we start to use jargon and you don't understand us, please bring things up with the chat. We'll be monitoring the chat throughout the process. Ambrosia, jump in when you see chats and when I'm talking, and we'll do the same. We really want this to be a dialogue, and I'm happy to say right now is about 31 folks on the call. 3 or 4 of us are, Monica, or the 3 of us from CSH, so we're at 28. So we really hope this is a dialogue. Heidi's team submitted, so thank you. Approved, haven't started services yet for Solutions, so that's great. Thank you, Carolyn. So agencies, I heard all different things. I heard approved, all the way back from haven't even started yet, just starting to think about it. We're going to make sure that we tailor the materials to all of you. Know that everything here is, and you'll hear me say this many, many times throughout the Academy, none of this is substitution for official guidance from DHS. DHS puts out the regulations. Our role here is to help you say, okay, in this program, in these parameters, in these rules, how does my agency execute a program that serves the needs in my community? So, and Shanika's also approved, haven't started the services yet. So congrats for getting through that process. If you've been through the process, we're talking about a piece and you want to talk in and jump in about what your experiences is, people should be able to just take themselves off mute or raise their hands, etc. We really want this to be a dialogue. And for those agencies that are further down the road in this process, like yourself, Shamika, you can be really helpful to the other agencies that are just beginning and starting it as well. I know CSH, Corporation for Supportive Housing, has done some of this work in the housing space. I do want to be really clear. We are here to talk about the administrative aspects of every different 1915I service. So whether you're planning on doing benefits navigation, care coordination, you're planning on doing peer services or respite services, the administrative tools and examples that we're going to give you are going to be helpful to you in that process. Yeah. All right. So next slide, please. All right, so this is the schedule that we'll be going over the next 6 weeks. Every session, we're going to have a session like we're having today, and then we're going to have an open office hours question and answer period. That's on Friday afternoons, etc. The office hours are all they are all optional. They are something didn't quite make sense to me, didn't understand, don't really know what to do. Please come to the Q&A and we'll talk through that process, etc. And this is a very thoughtful, intentional list of sequence, I should say, of the topics we're going to cover. This is really, if you're just starting out in Medicaid, this is what you do first. First, you focus on provider enrollment, and we're going to orient you today to how the Academy works and the pieces of this. 2, you think about service participant enrollment. Okay, my agencies now approve services. Can I work with individuals who are families who are approved to or who are approved for services? That's participant enrollment. That's session 2. Session 3, we're going to talk about staffing and budgeting, how you give your agency tools to help develop your total cost of care to make sure you're not only running a quality program, but you're running a fiscally sustainable program. Session 4 is on policies and procedures. Medicaid has a variety of rules. We'll talk often about how some of those rules are made at the federal level, some of those rules are at the state level, about the process and conversation that happens in that, and how to make sure that your policies and procedures reflect your agency's practices in order to remain compliant with the Medicaid program. Session 5, this is everybody's favorite, documentation and billing. Getting paid doesn't happen to your bill. So we talk about session 5 there. And then session 6 is quality, how to ensure that you have a quality program and how to ensure that you have a compliant program. For each of these sessions, there will also be tools. These are CSH developed tools from our work with other agencies across the country. None of these are required. Let me be very clear. I do not have the authority. CSH does not have authority to require anything, but we think some of these tools and templates can be helpful to your agency as they begin to adapt them and make them work for your agencies, for your workflows, for your policies and procedures, for your activities. Oh yeah, so that is the session. That's what we're going to be spending the next 6 weeks together doing. We've got the Wednesday afternoon sessions, and then we've got Friday afternoon sessions for Q&A. Again, Q&A is for your benefit, not necessary, not required. So next slide, please. Thanks. This is the purpose of the Medicaid learning sessions. This is really to make a distinction between what the roles here are, et cetera. We're grateful to have DHS be part of the process because DHS is really setting out the what, they're setting out the policy requirements. The TA team here, myself, Ambrosia, Hillary, will help you here to think about the how. How do you develop a plan for your agency? The goal of the Medicaid Academy is the work plan, is a work plan for your agency to be able to take yourselves from just being approved as an agency or even beginning to think about approving as an agency, and then take you all the way through to a fiscally sustainable program that's serving the needs of individuals in your community. How do you take the requirements that DHS has put in place, and we'll talk about which ones are DHS requirements and which ones are federal requirements, and then how do you make sure that this is executed effectively within your agency? We're here to support you through this. CSH is working with the state through into 2023, and we'll be doing individual technical assistance too. But for the purposes of the Academy time, we're going to focus on this training. We're going to focus on grounding you in all things Medicaid and the Medicaid program, and then we'll be working with your agencies individually. All of the recordings of the trainings will go up on the state website. The tools, once approved by the state, DHS will go up on the state website as well. Again, the goal is to download, nothing scary in my life than a blank screen. We want you guys to download and adapt them to help your process. So we'll give you helpful tips and tools, we'll give you opportunities to share across experiences, and we'll support the agencies. We're going to do breakout sessions. I don't think we've got the technology quite right to do breakout sessions today, and there's a lot of material, but we will be doing breakout sessions in the future so that your team can come together and also so that your team can come together and say, okay, we've got our work plan, we learned this, who's executing the work plan, what do we do in that? How do we make sure that we are operationalizing this, implementing the program in the way that we learned? So yeah, so next slide, please. So for each of your agencies, we asked for 4 different lenses, if you will, not 4 different people. Some of your agencies may be small. You may not have people who do this, but we want people who think about your program and your agency in 4 different ways. We need an executive lead. This is a decision maker. This is someone who's learning enough about this to say, okay, these are the resources I need to make available, these decisions I have to make within my agency. We need a program lead. We need somebody who's really connected to the folks on the ground and doing the work, and the people who are receiving those services, and really brings that lens to the work. We need somebody who's looking at this fiscally. How are we making sure that payroll happens, that cash flow is in a good state? We need somebody with that lens. And then finally, we need a quality lead. Whose job is it within your agency to ensure that you are delivering high quality services? So each of those different large agencies may have 4 different people on those roles. Smaller agencies may have 1 or 2 people in those roles. Gosh, if you're a single person agency, what I'm calling work plan is also known as a to-do list. But whatever size your agency is, we want to make sure that you're thinking about it through each of these lenses, because the implementation plan that you will be putting together has aspects of each of these roles within them. So an executive lead, a program lead, a fiscal lead, and a quality lead. You want your team to be either have 4 people who do that, people who have those roles, or people who think about things in those ways, so that you can think about it. If you're both, say, the executive and the quality person, then take a minute. I'm going to spend 10 minutes on my piece of the work plan, and I'm going to spend half of that time on, or an hour on my work plan. 10 minutes is too little. I'm going to spend half an hour looking at it from a quality lead perspective. Then I'm going to spend half an hour looking at it from an executive lead perspective. Each of those lenses all really important for your thinking here. So yeah, next slide, please. Is this where, okay, so throughout the academy, we talked about the trainings, we talked about these are the topics we're going to cover, we talked about tools. The tools are going to be there for you to download, they're going to be on the state website. Again, if the tools are helpful for you, run with them, they're yours to take. If the tools aren't helpful for you, none of this is required. We'll give you the regulations that are required, what the requirements are, and we'll help you think about what's the best way for you to operationalize that for your agency. We'll give you time to do the team work planning, and then we'll give you time for questions. Medicaid is a very complicated program. Let me say that. Ambrosio's heard me say that too many times. Let me also say that many of these questions some questions have been answered before, they're fairly easy. That kind of a question is the exception, not the rule in the Medicaid space. In the Medicaid space, the more common question is, I don't know, it depends how you think about it. Let's find the regulations. So we're also going to keep what we call a frequently asked questions document, or an FAQ, that we'll be building throughout this process. Questions are asked, the simple ones are answered. That's great. Sometimes we're going to say, I don't know, we're going to have to go back to DHS. Sometimes I'm going to say, Monica, what do you think about this? And Monica may say, I need to go back to my friends in the Medicaid division. I need to go other places to figure this out. We're going to be talking about billing. We're going to have folks on, I'm hoping, from Blue Cross Blue Shield, as well as from the state. So yeah, so questions are important. Put them in the chat. If we've got time, we'll cover them in the sessions. I hope we do. And know that the questions that we can't answer for you quickly, we will be doing the research in order to get you that answer. A lot of these are DHS and DHS regulations. We also, if we give you an answer, we want to be able to tell you and make the distinction between this is best practice in writing a service note, in developing a policies and procedures. This is DHS requirements, and we always want to give you chapter and verse on those requirements as well. So this isn't because Marcella said it. I don't have any authority here. Here's where it is within the DHS process and system, so that you can refer back to that and you're aware of what it is that you're working towards compliance on. We just think that's really, really important. So we're excited to be building that FAQ. All right, next slide, please. So once the academy ends, we want your team to leave with a work plan that can be implemented in the coming months. Know that you will not be able to complete everything in this 6-week period, even just the provider enrollment piece. If you're one of the agencies that hasn't started yet, you may, it's taking a couple of weeks. Folks may have better data than I on that. For you submit the application, how long does it take for Meridian to get back to you? If you've got to change some things or add new documentation, et cetera, how long does that back and forth take? Know that we want you to be building that work plan. You're not going to be able to complete that work plan by the end of this 6-week period, but you will know what the roles are. You will know what the tasks are, and that you will be able to build on them. This is an iterative process. You enroll as a provider, you enroll service participants, you deliver services in that way, you plan for it. So you're not going to be able to do everything in the next 6 weeks, just not possible, but you will have a work plan that you can begin to guide you over the next, 6 to 9 months to over a year as you're beginning, as you're starting or, getting close to the end of that initial startup period for the new service. After the academy ends, we're going to be meeting with each of the agencies and work with you individually to support implementation of your work plan. So next slide, please. So our plan for today is some of the discussion that I've been doing today. This is the orientation, and then we're going to go through provider enrollment, what your agency has to do to be a provider. Agencies that are already approved, and this isn't a helpful process for you, feel free to drop off. That's all good too. We never want to take up anybody's time that doesn't need to be here, but we know we've got a lot of agencies also on who haven't enrolled at all, who haven't started that process. Now, if one or two of you stayed, so you could answer some detailed questions, we would appreciate that as well. Let me take a breath and ask everybody any questions now at this point. So we're going through our orientation now, and then we're going to provider enrollment. I heard a voice, but I'm not sure that I heard a question.
That was me, Marcella. Would we
Okay.
be able to, once again, since we've had some folks join, ask everyone to put in the chat what agency you represent if you haven't already done so?
Yes, please.
Thank you.
Yes, we want to know who's here. And also, as you're putting in what's your name and your agency, also let us know whether your agency is enrolled yet in the service. If you look through the chat, you'll see a bunch of folks from other agencies talking about. Yes. Oh, yes. And knowing the future agenda will always give you that schedule. Katie Severance is here. She's the finance director. Hi, Katie, from YWCA Cass Clay. Know that not all members of your team, let's pretend you have 4 members of your team. Thanks, Ambrosia, for that reminder. Not all 4 members of your team need to come to every session, and we will tell you at the end of the session, the next topic is X, and these are the people. We need your program lead, we need your fiscal lead, we need all of those, etc. So yeah. So Heidi Hansen is here, and she's from the and they're in the middle of the enrollment process. So I hope we can help you and make that as easy as possible for you, Heidi. All right, so next slide. All right, we are going to go through now through your agencies. What we want to hear just in the moments of time is if we can have one person introduce themselves and then the other people from their team that are from their agency. And what we're looking to hear from you is what your role is at the agency, like Katie just let us know for her, and what you hope to gain from the academy. So yeah, so let me see. I am just going to call on people just so we're not talking on people. So I'm just going to take my list of names, etc., and call out some of my first names. So let's see. I have a Brenda Bergser, and Brenda, you've got a Yahoo email, so I don't know what your agency is. Are you on? All right, I don't see Brenda. She was on my list. Okay, my next name is Kelly Smith from MTC or MTC Medical. Kelly, who's on from MTC Medical? Can you say hello? Introduce yourselves.
I don't know that Kelly is on, but I can talk about MTC in general. So I'm Lisa Peterson. I'm the director of behavioral health within MTC. MTC is an organization that does prison operations and also transitional facilities work. And now we're developing outpatient behavioral health programming in North Dakota. So my role is an oversight in the corporate side of behavioral health services. And then I saw that Gabe Utley is on. Gabe is a finance director with MTC. And then we also have Keith Smith, who's senior director of medical and oversees our medical arm of the company and operations. And so what do I hope to gain? So we have a partnership with the Department of Corrections in North Dakota and are looking to be able to become enrolled as a Medicaid credentialed provider. We'll mostly be providing substance use disorder treatment, but I think we're interested in learning, what other things we could offer in the future once we have this credential.
That's great. That's great. And you gave 2 other names there, Gabe Utley. Gabe, would love to hear from you, and then your other person.
Hello. This is Gabe. Looking forward to working closely with Lisa and this North Dakota project that we have. That's a nice adjacency to what we already do.
And hello, this is Keith Smith, as Lisa said, from MTC Medical, and likewise with Gabe and Lisa. I know Lisa's spearheading the efforts up in North Dakota on this new project, and just wanted to kind of get on board to listen in and learn what the aspects are for the application of Medicaid.
Sure. And has your agency done Medicaid before in other areas? You will often hear me say, your first Medicaid service is often your hardest.
So this is Christine with MTC Medical. We've not done Medicaid in other areas. However, I do have a background in billing, so I'm excited to get to work with Medicaid in a new environment, although the Medicaid I've worked with is in Utah. So yeah, we're all excited to have this new little project.
They are grateful to have you there as well, especially you, Christine, with the Medicaid billing background. Oh yeah. Okay. Let's see. Let me go back to my list. So the next agency on my list is Nexus Path. Can folks from Nexus Path introduce themselves?
I'm Heidi Hansen. I'm finance director here at Nexus Path, and I have my provider enrollment people on with me today, and as well as our billers. And we are hoping to learn more about the 1959 program and about provider enrollment in general. We have a lot of new faces on our team, so.
That's great. And Heidi, what kind of services does Nexus Path and where does Nexus Path usually deliver those services?
Well, we have offices all across the state of North Dakota. Yeah, and we mostly work with behavioral health and treatment foster care.
Awesome. Thank you so much. That's such important work. All right. Let me go back. And the other folks from the Nexus Path team, can they introduce themselves? I saw a couple of names in the chat.
I'm Tiffany Wardlow, and I do some billing for Nexus Path.
Welcome, Tiffany.
I'm Kayla. Oh, sorry.
Go ahead, Kayla.
Okay, I'm Kayla. I also do billing for Nexus Path.
I'm Claire. I read the school-based TCM worker notes for billing.
You are well versed in all things Medicaid. Great. Anybody else from Nexus Path?
This is Maurice Fronning. I do billing for Path as well.
Welcome. Welcome. Thank you for joining us. Anybody else?
Hello, this is Heather Simonich, Operations Director at Nexus Path.
Welcome. Welcome. All right. We got a good Nexus Path is in the house, as they say. Oh, yeah. Anybody else from Nexus Path? All right, so my next agency is Dakota Foundation. Who is on the team? Who is on the line from Dakota Foundation?
Hi, I'm Doreen Eichley. I am the Chief Operations Officer for Dakota Foundation. We provide services in Bismarck and Fargo. We do residential-based and community-based services and have for the last, since 1970. What do we hope to gain? We have contracts with the state of North Dakota to provide most of our residential services, but the community-based services, we have some contracts, but we are being asked to start billing for Medicaid for some of them. And so we're just trying to learn as much as we can so we understand how we can do braided funding.
Exactly. And thanks, Doreen. And who else from your team is on here?
Candia Quall, Jeannie Messel, and Hannah Watches.
Can you, can these folks introduce yourselves and to tell us what your role is at Dakota Foundation?
Sure. I'm Candia Quall, and I'm the program director for the Fargo region. So I oversee all of the programming and contracts in the Fargo area.
Awesome. Nice to meet you. Other folks.
I'm Hannah Watches, and I am program director for the Bismarck region.
All right.
And I'm Jeannie Messel. I'm the supervisor for the permanent supportive housing project here in Bismarck, Edwinton Place.
Awesome. Awesome. Thank you. I've heard great things about Edwinton Place. Oh, yeah. Anybody else on from Dakota Foundation? All right. Let's see. Some pieces are with Gmail. I've got some Gmails on my registration list. That's how I'm guessing this here, etc. Let's talk to the folks at the YWCA Cass Clay. Who's here from that, and introduce yourself and your team and what you want to get from the Medicaid Academy.
Hi, I'm Ashley Mitchell. I'm at YWCA Cass Clay. I am the HR director, and we operate an emergency shelter and supportive housing programs for women and children experiencing domestic violence and homelessness. As far as what we are hoping to gain from the Medicaid Academy, we already provide a lot of services that are supported by 1915I, and so we're really hoping to learn more about it and help kind of roll this out with our team.
Awesome. Awesome. Yep. Diversify your revenue streams. All those business people keep telling me that.
Exactly. And then we do have our finance director, Katie Severson, and then our housing director, Sarah Selseth, on the call as well.
Awesome. Awesome. Can they introduce themselves and tell us what they're here to learn as well?
Sure, I can go. My name is Sarah Selseth. I'm the housing director at YWCA Cass Clay. So I oversee all of our housing programs that we offer. I kind of like Ashley said, a lot of the things that are supported by 1915I, we already do. So I'm just looking forward to seeing how we can just kind of incorporate those things into the services that we already provide our folks and continue to support them in working towards independence.
That's great. That's great. So appreciate it. Anybody else from YWCA Cass Clay?
This is Katie Severson. I'm the finance director. And yes, diversifying revenue streams is something that we're interested in, and being able to provide that additional support to our organization.
That's awesome. Awesome. Anybody else? All right. What about, I saw Native Inc. was in the house and then had to step out for a second. Is Tanya back or? Maybe not. Okay. What about the Healing Center?
Yes, my name is Shanika Bordeaux Collins. I just got approved for my private practice for the Healing Center Counseling Consulting Services. We will be.
Congrats.
Thank you. Addiction treatment services to the community. Currently, we are providing care coordination and free through recovery services. And we hope to get out of this ways to, of course, diversify revenues, streams of income, and also ways to serve our clients. By, of course, being able to utilize Medicaid as a income source for those.
Absolutely. Thank you. And Shanika, anybody else from your team on board today?
No, unfortunately, the care coordinator, she's not here today, but she will be attending the other sessions.
That sounds great. That sounds great. All right, welcome, and we're so glad to have you here. Those services just desperately, desperately needed in all our communities in so many ways. Let me see. Solutions in practice. Am I getting the name right? I
Yep,
believe. Is that our agency?
Solutions Behavioral Healthcare Professionals. I'm Carolyn Mesky.
Thank you.
Yeah, I manage the Bismarck. We have Bismarck and Fargo offices in North Dakota. We do mental health, behavioral health. We've been billing under Medicaid or providing Medicaid services for a long time. And so for us, it is just learning about the protocol for 1959 billing. We'll be bringing on a care coordinator. And then we have our one of our billing staff, Courtney Schultz, who does our primary North Dakota Medicaid billing, and then Brandon Germain, who oversees our ABA intensive behavioral programming.
That's awesome. Are they on? Can they say hi?
They are.
Trying to get to know everybody.
Hello, Brandon Germain. I'm a board certified behavior analyst and I oversee our ABA programming for mostly youth in the area.
Thank you. Thank you. And did you have one more person on your team there, Carol?
I'm Courtney and I do primary billing for North Dakota Medicaid.
Thank you. We're going to need your voice here, my dear, especially when we get to session 5. So thank you for this. All right, let's see. I believe Project Bend, am I saying that correct? Just going over his emails. Folks from Project Bend are on.
Oops. Can you hear me?
Yep, I can hear you.
All right, it is actually Project B. We're here in Minot, North Dakota. This is Liz Larson, Executive Director. I have experience doing a lot of both practice as well as billing for Medicaid in other states. And then I have my program director here, Kala, and she kind of oversees all the programming and does kind of the liaison between program and dollars. And I have a couple more folks that are on another computer in another office, but we were originally the YWCA Minot. We provide homeless services for men, women, and children. We also do preventative, and then we're trying to get more into like the following up after they leave. And that is one reason why we are interested in 1959. I don't know if Zach and Ian want to say hi.
Hi, I'm Zach. I'm the case manager at Project B. Ian had to step out for just a moment, but he's our intake specialist.
All right, well, welcome to all of you. Anybody else from Project B, forgive me for the mispronunciation, that is part of the team here that we want to meet? All right, I assume that's everyone. So let me go back to my list of who's on this and who's part of the team. Let's see. I think the only other, any other agencies that I've missed? I know Native Inc. I think somebody had to step away for a moment. Anybody on from Native Inc.? Any other folks that are on that didn't get a chance to introduce themselves or their agencies or their roles? We had a couple people, the way I was doing this was just going through our registration list, and a couple people were on Gmails or iCloud emails. So Wendy.
This is my name is David Richter. I'm with Wilson Council for the Aging, and we're looking to get our application in for Medicaid so we can be a provider and expand our services using 1959.
That's awesome.
The rest of my staff had to step out because stuff comes up with seniors every once in a while. So that's all.
Appreciate it. Thank you, sir. Wendy, I see you put your camera on. I don't think we've heard from you either.
Nope. My name is Wendy Schmidt, and I am a lead development and education specialist at Sanford Health in Bismarck. Obviously, we are enrolled in Medicaid, but we are not enrolled in the 1959. And I oversee the community health worker program, which is a service provider.
Yeah.
And currently in North Dakota, they're not reimbursable. So we're looking at alternative reimbursement options to sustain the program. Additionally, our behavioral health clinic here in Bismarck is hoping to hire somebody who can be a care coordinator for the program. So I've kind of been the person assigned to learn a little more about it. So obviously at Sanford, we have lots of different people, but I'm the one just kind of getting the information. We've We've submitted some documents and we're working on the application, but haven't submitted the application for 1959 yet.
That sounds great. That sounds great. So helpful. All right. Thank you for joining us today. Any other agencies or people we haven't had a chance to hear from yet?
This is Leanne Pollard from Jamestown. We started L&M Care Coordination for 1959 specifically. So Mary Zinker and I are co-owners, and then we have Deb Gletney, who is also on, who is our quality management lead. And so we're just starting out. We want to serve people who are most vulnerable citizens of North Dakota, and that's why we started this company.
That sounds great. What's the name of that group?
L&M Care Coordination Services.
L&M Care Coordination Services. All right. Thank you so much. And other folks on your team want to say hello and introduce themselves?
Hi, I'm Mary Zinker. I'm a nurse also, and I'm co-owner with Leanne Pollard.
Awesome. Wonderful.
I know Deb Gletney had indicated she was on, but I'm not sure she's in another state. So I'm not sure if she's on and able to comment or not. So
This is Deb Gluttony. Can you hear me? Okay.
Yeah, you sound great.
Okay, great. All right. I am excited to be a part of this and to learn more about enrolling in Medicaid, and we're excited for our new agency, because I think it's only going to provide many more services to individuals in the community and the area around surrounding Jamestown. So we're very thrilled, and I'm thrilled to be a part of this actually as well, because I've served in DHS services throughout my 45 years working with them, and also in specifically in behavioral health services. So it's my passion and my excitement for expanding services further in the state. So thank you.
Sounds great. Anybody else? Who we missed? Anybody not been able to introduce themselves? We're going to spend the next 6 weeks together. I want to make sure everybody knows each other and is also, and knows who's connected, be able to support each other. We're going to bring you as many answers as we can. I know Monica definitely will, but we also know many of the answers and much of the wisdom is within your community as well. All right, so I think we've got everybody here. So welcome, and thank you all for taking the time and getting to know each other, and really look forward to working with you over the next couple of weeks. Next slide, please. So let's think about my agency is starting to become a Medicaid provider. I heard a couple of you are at the very, very intro process. Some of you are even, just starting out as an agency. Others have been around for a while. As Monica said, you've been getting the grant funding, but they're switching to Medicaid. Others are part of big entities and big systems. I think of Wendy from Sanford, et cetera. Somebody knows. Somebody definitely knows how to bill Medicaid in Sanford, but this particular program, you're trying to get an angle. So we're all coming at it from different angles. And I want you to think about what, as agencies begin to shift to become a Medicaid provider, and as you begin to take programs like, say, a community health worker program or housing services program, and you want to think about, or a shelter program, and you want to pull down Medicaid as much as you're able, what's impacted within my agency. So next slide, please. So the way we talk about this within the Medicaid Academy is we talk about the 4 different lenses. Each of these lenses are important. Each of these lenses intersects with each other, and each of these lenses also needs their separate time to think, okay, What's changing programmatically? What's changing staffing wise? What's changing strategically? What's changing analytically? And what's changing logistically? When I say program, and this is the one that we really, if it's working for you, if I like, you have another slide somewhere where it says, if it's not broke, don't fix it. Programmatically, you may be doing exactly what you need. Your folks may be getting the services they need. You probably are having trouble with staffing, but other than that, you feel like things are kind of going okay. You don't want to change too much. That's totally allowable. What you're changing is, as we said, diversifying your revenue streams. But if you also want to make change, this is a real opportunity. This is a real shift for agencies. They can see this as a growth potential. They can see this as also thinking about how to sustain their programs over time. So think about this from a service provision, from a programmatic lens, from a staffing and training lens. Who's delivering the services? What support do those individuals get, et cetera? And what do we need in order to sustain our program long term? Think about it from a strategic lens. Think about it from a growth perspective. Think about it from a business partnerships perspective. Who are you working with? Who are your strategic partners? I always say it's a big program. It's a complicated program. Nobody knows it all. Own what you know, own what you don't know, and make friends with people who know what you don't know. So that's the partnership piece. Beginning a business partnership, thinking about strategic long-term planning and growth, thinking about how there's being investments after years of disinvestment, some real investments in many of these what are called home and community-based services, and a really exciting commitment on the part of North Dakota to serve all of the residents, including particularly folks with behavioral health issues through the 1915I service. So think about it from an analytical perspective, thinking about it, what data do you need? What information do you need? What quality assurance processes do you need? How do you advocate for your programs? How do you understand, this is session 3, your total cost of care? What does it take to really do the work and deliver the services? And how do you estimate that in a way that says, this is the rate we need. This is what we need in order to be able to keep the program fiscally sustainable. So think about it from a data management perspective, what information and equality. Finally, from logistics, just how are you going to implement this? From who's got the copy of the W-9 that I need to do provider enrollment, we'll talk about that today, to what's the training qualifications of our current staff, what does Medicaid require, where do we have opportunities, and then where do we have gaps? So think about it logistically, think about it from a financial operations. I'm thrilled to have so many people who know Medicaid billing on here. Definitely going to be turning to you throughout this. What legal agreements in place? What HR considerations? I heard we had an HR director here. What criminal background checks are required? We'll talk about that. Who needs to be looking at our billing systems and what is that's required in there? How do we keep information safe? The state's been very clear that 1915I, like all other Medicaid services, is a service that requires HIPAA compliance. What does HIPAA even stand for? And what does that mean for my agency? And how do I ensure HIPAA compliance? We'll talk about that in great detail as well. So each of these lenses important as you make this transition for your agency, as you grow your agency, as you work to create a fiscally sustainable agency. Again, I love the trainings on best practices. That's not what we're going to be talking about too much here. We're mainly going to be talking about the many administrative aspects of Medicaid. And that's what this training is for. So next slide, please. So we, throughout the process, is going to share all of the Medicaid Academy materials. We'll have recordings of the trainings. We'll have the slide decks. Thank you, everybody, for consenting by staying on to be part of the recording. And this will all go on the state's Medicaid site. Thank you for this help, Monica, the 1915I training section. We will also talk about tools. We've got a tool for you today. Today's tool is called the Group Provider Enrollment Guide. This is, as an agency, the first step in this process is enrolling your agency as provider, enrolling Native Inc., enrolling Nexus Path, enrolling the Healing Center as a Medicaid agency. And then each of the individuals who are delivering services also need to be enrolled as well. So that's the process that we're going to talk about today. And we've got a guide, literally step by step, screenshot by screenshot for going group enrollment. And that's a link there. These links will all be coming. You'll be getting emails, a lot of emails from Ambrosia over the coming weeks that'll have some of these tools and have the slide decks and the recordings on there as they go up as well. Okay, so next slide, please. So how do we prepare you? This is part of the orientation, getting the most out of that academy. Know who's on your team, know how you're working with your team, who's got the vision from executive, who's got the fiscal vision, who's got the program vision, who's got the quality vision. Get everybody clear on the team roles and the team goals. Get your work plan in a place that everybody can put in, everybody can contribute to the document, et cetera. Use a platform, use SharePoint, is what we use at CSH, or something like that. So you're all working together. So that work plan for you becomes a living, breathing document. Access the shared tools, download them, try them out, take a look at them. If you can't take a look at them before the sessions, when we use them, that schedule in the beginning of our slide deck said what tools are coming at what sessions, and we can get you those materials as well. Take advantage of the TA offered, though that is primarily going to be part of the sessions for these 6 weeks, and then we're working with your agencies afterwards. And then finally, ask questions. Try to understand where to focus your time. Again, Medicaid is big, Medicaid is complicated. It overwhelms a lot of people. I tell you, work with us, plow through. We're going to help you answer the questions. You don't have to get it all at one time. I promise you that's just not possible. But begin to understand something about the structure, how Medicaid thinks about things. In many ways, it really is a culture, so that when you hit that next hurdle, if we say, or step on the road to Medicaid nirvana, et cetera, you can know what questions you ask in that next step. So next slide, please. All right. So we want agencies to come up mute and tell us. I know that Ambrosia was sending you provider readiness assessment checklist. We were sending you the agency needs assessment. We've got a copy of the work plan template here as well. But we asked you a number of questions to try to say, do you do this? Do you have a data system? Do you have a billing system? What are you doing in regard to HIPAA compliance? All of these things that may be questions for you. We'd love to hear from a couple of people about how that process was that helpful to them, where there's questions, things that made them think about things they needed to do for their agency and their work. Love to hear from you in that. What did you learn from that process? Some of you may not have completed them or submitted them yet, and we'd love to get them all back from everyone. That gives us a better understanding of where you are and how we can best support you. Oh, I hope it's not a shy group. And Ambrosia's putting up the form there, so thank you, if your agency hasn't completed it yet.
Yeah, well, I'm curious to see if maybe someone opened it and closed it because maybe they weren't even ready to fill it out yet. What did you guys think of the questions that you looked at, or maybe you're still pondering even though you haven't completed the survey, if you got that far? I know about 4 agencies have done it, but there's still some folks we haven't received responses from. So curious to know if you had a chance, 1, to open it, and 2, what you thought when you opened it, if you got a chance to do so.
I just have a question, I guess, because I just looked at it and I was hesitant to start it, right? Because I don't think that I personally am going to probably be able to answer all the questions. So maybe you could go over what are the types of questions, because it looks like you can't see what the questions look like without starting it, if that makes sense. So my initial thought is that we all need to get together probably and screen share and work through it together, but I could be wrong.
No, that may make sense, because there are program questions on there. There are fiscal operations questions there. You're going to need your team in order to be able to do that. Ambrosia, can you talk a little bit more about that session as well, that piece as well?
Sure, and maybe there's a way for me to show you guys it. Let me try to do that, because I think that will kind of ease some of that too, right? Understanding what you're trying to ask me and who needs to answer that. So it can be one point person. Traditionally, actually, we do this as a phone survey with one person. And so that person hopefully is in a position to know kind of from a general high view lens the answers to these questions. It could be maybe your executive role person that would know these answers. So it asks, we're asking you guys, what services are you currently offering? And we've heard from some of you today, hey, we've been doing this for a while, but now 1959 is a new mechanism for us to be compensated. So that's kind of the first area, is what you're currently doing now. So I'm going to show it to you guys. I'm making up stuff so we can click through it. This specific question was around, like, assessment process. What tool, is there a specific assessment tool, like a best practice tool, clinically based, that you would be utilizing to assess people? And then whether or not, you've been thinking about who on your team needs to help support this transition for you. And if so, have you written a transition plan? And then we wanted to know about like what you've come up with so far. If you're not in that position where you haven't done that, we also want to know that too, right? So we can know who we need to be talking to and giving targeted TA to help you do that. So those are, again, as you can kind of see, hopefully these are more like higher level questions for an agency to answer, to help drive for us what you need from us specific to the TA. Marcella talked about the fact that later on there's going to be an opportunity for us to break out with you guys individually as TA providers, and we want to make sure for each agency that that is something we have pre-knowledge about as far as where you're sitting and what we need to help you with. Hopefully it won't, and then there's specific around, as you can see, yes or no if you're already billing Medicaid. Hopefully that helps. Any questions now that you've kind of seen it a little bit?
No, that was helpful for me. Thank you.
For the agencies that have done it, any questions? How was it helpful?
This is Heather Semenich from Nexus Path. I mentioned before my role here as an operations director over our community-based programming. And so I feel like sitting in my seat, I could adequately respond to those items from a high level. So that was comfortable. I guess I would just say for us at Nexus Path, our biggest questions lie around actually EVV and how it interfaces and how we're going to get the billing to work with our electronic health record, given we have to use the primary service we're looking to provide is respite for children. And I guess, so to me, the survey was just maybe helpful in thinking about what missing pieces have we not had conversations about. But for us, just being really super familiar with Medicaid billing in terms of a variety of North Dakota state plans, there's just unique elements with 1915I, I think, especially for us around the respite care piece that I'm hoping we can get some technical assistance on.
We will see what we can do. Certainly do our best and work with the state to get clarity as well. But again, often it's the state says the rules and then we can come back and help you and make sure you're compliant with all of those. You'll hear me say that a lot. Thank you, Heather. That was really helpful. All right, so next slide, please. But we do want to recommend that you do that. Oh, and the last slide also had a link to a work plan. This is just a sample, the work plan template. Thanks, Ambrosia. That's on the previous slide. So just click on that. If your agency already has a work plan, process and system that you use, go for it. If you've already got project management systems, et cetera, that's great. And if you don't, and you just want a simple spreadsheet and you don't want to have to come up with yourself, here's a great one you can download and adapt to all of your areas and materials, et cetera. Adapt to all of your tasks, adapt to all of your staff, adapt to all of your timelines, et cetera. So I hope that's helpful to you. All right, so next slide, please. Remember, our goal here is that you leave with a work plan, with a work plan that while it is not completed, it has all of the tasks. So we ask for agencies between meetings, think about agencies meeting, that your team, if it's a couple of people on your team, get some time between the meetings to come together. What platform are used to continue with the work plan throughout the academy and beyond? You're not going to be using we don't think you'll be done with the work plan. You won't be able to implement the work plan by the time we get through our process, et cetera. But we do hope that you'll be able to use that over time. So think about how you're going to communicate that, how you're going to file share both within your agency and across agencies. And we can especially work with you on those pieces as well. And then what did you learn from provider readiness? We hope that some of that tells you what to work on right away. It tells you where your agency is in this process. It tells you where some of these initial challenges are from a Medicaid administration perspective. So we hope that was helpful. And as Ambrosia said, thanks in the chat, we'll send out the PowerPoint that'll have all the links and the docs on it. You'll be getting those every week and can download those as well as from the state website. So next slide, please. So I think we're at 2 o'clock. Let's take a short break. This has been a lot. It's a lot to sit for an hour. So thank you, everybody. It's a little after 2 o'clock, and I'm sorry, I'm in the East Coast. Forgive me. And Ambrosia is in Pacific. Let me talk Central. It is 1 o'clock, and we will come back at 10 minutes after the hour. So we'll see you all in about 10 minutes. All right, it is 10 after, so welcome back, everybody. And we are going to be spending the rest of our hour together here today to talk about provider enrollment. So I heard a couple of agencies say, hey, we've already gotten through provider enrollment. If you have, that's great. If you feel like you've learned everything about it, feel free to jump off. We don't need to hold you on here. But again, if anybody can be on and kind of coach us through or support any of the other agencies here, we really appreciate that as well. But that is our next slide, provider enrollment. And I think, Ambrosia, you're going to share screens. I'm ready for slide 24, the role of provider enrollment. There we go. Okay. Thank you. We are a team. This would not work out without us. All right. So provider enrollment. Next slide, please. It's a process the federal government requires of every agency. You may be doing great work. I think I heard the YWCA talk about this in particular, and it's covered under the 1915I, but you're not getting paid for it. Well, one of the first reasons you're not getting paid for it is because you're not enrolled as a Medicaid provider. So every state's required to have a process. We're going to talk in detail about North Dakota's today. They have to verify eligibility and enrollment for all individuals. They have to verify the agency status, your agency status, the provider requirements, and then there's also a huge, you'll hear us talk a lot of times, and anybody from the Medicaid world talking about preventing fraud and abuse. We have to make sure that we're enrolling only providers with no history of fraud or abuse. We have to ensure state compliance with the federal requirements. We have to ensure agency requirements with agency compliance with the federal and state requirements. Lots of different people in this process. And anytime you hear a state be able to say, oh, we have this many providers, oh, but we think we need more, that's because they've been able to pull the data from the provider enrollment system. This is where you're going to be entering data in as you become a provider. So next slide, please. So becoming a Medicaid biller, I love this slide because this is the slide that always tells me when I start on a journey, I like to know where I'm going. And this takes you through all of the steps. So you've got your preliminary preparations where some of your agencies are, you're talking to your staff about it, you're talking to your board about it, you're talking about to your residents or the people you serve. Agencies often designate a lead person in this transition. They're sort of the organizing principle. They hold the work plan. They're making sure all the balls stay up in the air that you have to keep going in order to do the service. The first step is if you don't have one as an agency, you need a national provider identifier or an NPI number. If you don't know what that is, we've got links here to show you exactly where that is, and we've got websites and things, etc. Once you have an NPI, that's when you begin to submit the documentation requirements to the Department of Human Services. You need to submit a W-9. You just need to submit a business license. If there's any licenses or certifications that are required by DHS for your particular service, then that is required as well. We'll look that when we get through service definitions, we'll look at more deeply about all of those, but most of them don't have significant requirements other than the basic background checks, and we'll talk about that. When you get all of your process in and DHS works with a subcontractor called Meridian to process all of this, then you get a letter. That's from North Dakota DHS. That includes your Medicaid ID number as an agency. That's a very important number for your agency to keep track of. That's required in all of your claims. Claims are the documents that you submit to either Blue Cross Blue Shield or DHS in order to get paid, and every one of those requires to have your agency's Medicaid ID number on it. The state will give you here's your start date, August 1st, September 1st, whatever that date is. You may be delivering services before that date. You can't bill for services delivered to an individual until after that date. But once you have that letter, once you have that start date, we're past that start date, you can start delivering services and billing for the services. So that's really our goal, to get you through this process. Next slide, please. So there are two types of enrollment as we talk about. There's groups enrollment, and our presentation today is going to focus on that. That's getting your agency enrolled. Once your agency is enrolled, then there is individual enrollment. Anybody who's a direct service provider needs to be enrolled individually as well. They need to be enrolled as part of your agency. So that individual enrollment needs to connect back to your group enrollment. So you need to have your group enrollment in hand, and then individuals who work for your agency and can document that your staff can begin the individual enrollment process. So two different types of provider enrollment, one building on the other. Next slide, please. Oh, this is just also makes me just think that anybody who's starting in the Medicaid world needs to hear sort of the kind of first Medicaid joke, if you will, which is that I've seen some other folks from out of state, if you've seen one state Medicaid program, they always say you've seen one state Medicaid program. So some of these things, if you've done Medicaid in other states, some of these things will be similar, and some of these things will be the same, some of these things will be similar, and some will be things like, oh, my state never did it that way. The answer is yes, these are state decision-making processes, et cetera, and many states do this process differently. The 2 steps in the group enrollment required for, we're supposed to change that slide for 1915I services. You can email your forms, you can fax them, you can do PDFs, and you do this through North Dakota's MMIS, what's called Medicaid Management Information System web portal. You put all of those details in there and put them through the portal. I will say that if you can email them, you get a response much quicker than if they are faxed or mailed. So PDFs are really, really recommended there. So next slide, please. All right, so let's go into group enrollment. Next slide. Make sure we get through all this. So your agency needs to complete the provider enrollment in the North Dakota MMIS web portal, and we've got the web portal enrollment homepage on here. We also have a web portal provider enrollment guide. A lot of what we're going to talk about today is in that provider enrollment guide. So these are some of your first places to check when you have questions. When you submit your application, you will get a tracking number. Anytime you ask a question, anytime you process this, you will need that tracking number for that process. So Medicaid's very big on you got a lot of numbers and you got to keep track of them because you can't move anything forward without that number. And thanks, Monica. Said all emails to Meridian are automatically encrypted, so you don't need to figure out it securely. I don't know who got that changed, but thank you. That is really, really helpful there. So, and again, yes, slides will be sent out. So yes, you will have something to refer to with all of these links on here. So you've got your state Medicaid.
Marcella,
Yes.
can I interrupt for just a quick question?
Absolutely.
This is Gabe from FTC. We just signed a contract and we're still hiring individuals. And so we're kind of in that initial stages. Is there a sweet spot where we need to finalize the application? Because I know if you apply too early, sometimes it causes challenges. Obviously, you don't want to apply too late, so it holds up your ability to provide service.
Yeah.
But is there a sweet spot in terms of this application process?
So I would say you want to get your group enrollment process in as soon as possible. And then you can start, I would say maybe have a quarter to half of your staff at least hired before you start the individual enrollment process. There's no downside to getting your group enrollment. And you can't start billing until you have individuals who can bill as well.
Yep. Okay. Thank you.
That's good. Yep. Monica says ASAP. Group enrollment takes longer. Thank you, Monica. All right, so next slide, please. So these are websites you're doing all this on. So following all state and federal rules around Medicaid funding includes in the provider enrollment process. There are a number of documents you want to sign here. This is part of what you're doing. You agree to have an NPI as an agency, and you agree to keep that NPI number current and active. You will not discriminate against protected classes, against people based on race, against people based on religion, against people based on gender, etc. You agree to follow the Health Insurance Portability and Accountability Act. That's HIPAA, and that's a link through there. But we will spend a lot of time on HIPAA, particularly on session 3 and 4 and 5, I believe. And you also have agreed to allow DHS, that's the state, to access records and audits as requested. You have to keep your records, Medicaid-related records, for up to 7 years. So these are some things that as you sign that big document, you want to have your lawyers take a look at, your board take a look at possibly, or someone who's knowledgeable in this space. And these are all the things you agree to, and make sure that you can follow these agreements, etc. There will also be, I may say this later, there's also, I know, a federal requirement that you will check what's called the exclusions database once a year to make sure that your individual or anyone who's in ownership of your agency is not on the federal list of excluded from Medicaid because of convictions of fraud and abuse. So next slide, please. So this takes us to the provider enrollment page. So if you click on that link that we just gave you, it will bring up this slide. You will click on group provider enrollment. That's what you're here to do. We're going through the group provider enrollment. There is also an individual provider enrollment there as well. We won't cover that in this level of detail, but know that it's very similar. Next slide, please. Can you click on, let's see, how do I make this button? This takes you through the instructions. It tells you through there. If you're doing this for an individual provider, it sends you back. It just gives you a little orientation to what this process is. So next slide. And again, I think more than covering all of these in detail, we just want to make sure that you have them so you can refer to them. You promise that everything's on is accurate, all the information, etc. You give them identifying information. I will say, know that what you put in here must be to the letter exactly the same as what you submit on claims. So if you say you operate out of office number 6 and you put a number sign and then 6 on provider enrollment, that's what North Dakota Medicaid has in there. And if you put on a claim that you operate out of unit number 6, now I know you're thinking, oh, come on, they're the same thing. This is a computer system. They don't know that. They're going to reject a claim and say, oh, this isn't coming from the right office. It's coming from unit number 6, not number 6. Except unit 6, not number 6, etc. So very important to look at very closely what you put in here, exactly to the T, to the dotted I and the cross T. This is what you're going to have to use going forward. Your agency name, it's your agency legal name. It has to match what's on your tax identifying documents. It has to match what's on your business license and your tax ID information here as well. So next slide, please. Very important to do these exactly and have all of this exactly down. You may want to also have files and take screenshots of everything you put in, because if you want to remember, hey, did I put in number 6 or I put in unit 6? Did I put in office 6? Then you're going to have that go back in information, because who can keep those separate? So identifying information, your group you're doing business as, your legal name, your tax ID, the begin date, the EIN was first issued, whatever the end date is, when it is you're going to renew it for, and if you are tax exempt, yes or no. For agencies that are for-profits here, there's some new, there's some additional forms that we're going to talk about today, trading partner agreements, things of that nature that are required for the for-profit firms, but not for the not-for-profit firms. So next slide, please. So are there any licensures or certifications? I don't believe, though, Monica, correct me if I'm wrong, of the services within the 1915 I don't remember seeing, though I'd have to check, any specific licensures and requirements. So this is another slide you put in there, and the system is geared so that it will tell you, oh, you said you wanted to provide benefits navigation. Here's any licensures or certifications required. But I don't think that's true for I services. Monica, correct me if I'm wrong.
No, for the 1915 I, the provider signs an attestation that says that we have all of the requirements, but they don't specifically collect anything.
They don't have that, but they'll this is still going to come up in the provider enrollment process, so just be aware of it and be ready for that.
Yep.
Yeah, definitely. Okay, thank you. Next slide, please. So licensure and certifications there, etc. Any license number states you're providing services in. This is if you were doing a service that required somebody to have a medical degree, somebody to have a psychology PhD, an LCSW. That's all those things. You'll have to go through this process and do, as Monica said, the self-attestation. Self-attestation means I am certifying by myself that I am X. I tell you that my name is Marcella and you accept that. Thank you. I don't have to show you my driver's license, my passport, etc. That's what a self-attestation is. Next slide, please.
I have a quick question about that too, if you don't mind.
Go for it. Of course, jump in.
It looks like we need then our substance use disorder treatment provider license from the state, because there's the individual licenses, which I have, I'm a psychologist, but since we're doing SUD, my understanding is we need that group provider license.
Which service are you doing under the I, Lisa?
We haven't, so we're doing this more for just general Medicaid services.
Okay.
Our primary focus is going to be substance use, but like I said, in the future, we looked at, growing into the I potentially.
So to prepare for this, we have not reviewed what the state requires for their substance use licensure services, so I can't really comment on that. I know that the I doesn't require any specific staffing or licensures in the same way that my guess is if you're doing like substance use residential, it would. So I can't answer the SUD specific question. I'm sorry.
Okay, no, we can look into that. Thank you.
But yeah, I can tell you what's in Pennsylvania, but you don't need that. So that's the state I'm from. So next slide, please. So this is provider identifiers. This is where you put in your national provider identifier. This is what the screenshot looks like. Next slide, please, because this will give us to me. That's, you want your organization or your group NPI, etc. None of the 1915I services also include a DEA, the Drug Enforcement Agency. That's not required. Nobody's a methadone provider here, things like that nature. So that's not required, but that's the provider identifier page. That's where you're going to put in your NPI. Know that within the Medicaid system, they are going to link your NPI to the Medicaid ID. Again, in order to submit claims that are clean and get paid, you are going to have to make sure that those two match. Many agencies have more than one NPI, they have more than one addresses, they have different NPIs for different reasons. Make sure that you know, if you're in charge of billing for the 1915I services, that you know what NPI is attached to agencies. NPI is attached for billing for 1915I. I'm thinking of the woman from Sanford who's like, you've got NPIs for your hospitals, for your clinics, all these kinds of things. You probably should have an NPI just for 1915I related services to keep it clean and keep it separate. So next slide, please. Again, screenshot, service locations, and billing information. Many of you will be doing the 1915I is literally a home and community-based service. You are not listing every place you will deliver services here. What you're listing is where your offices are. So if you have multiple offices, I heard people were in Bismarck and people were in Fargo, both places, et cetera, you're going to need to list those service locations and those different offices, knowing that many of them are just sort of stop-off points for your staff to go out in the community and deliver the services. So next slide, please. Oh yeah, so service location, list all of that. Again, the addresses have to exactly match what's on your tax ID so that your Medicaid ID will exactly match what's on your NPI, what's on your tax ID and EIN. So next slide, please. Service location and billing, again, you're going to give a contact person. We recommend that agencies often have just because this is one email that North Dakota Medicaid is going to send all their information to one email, we recommend that an agency come up with, just because staff turnover, and admin at solutionsbehavioralhealth.net, et cetera, or assistant at because it's when it's attached to a name and that person leaves, that email goes away. The state may be sending you necessary documentation and information required for keeping up your license or billing, et cetera. You don't want to lose that because you've lost that staff person. You want to be able to have that. So we recommend that you do it. You set up like an admin at youragency.com or .org email. So next slide, please. This is EFT, or electronic funds transfer enrollment. This is where you need your banking information. How do you want the state to pay you? So this is a very important form that is part of this process. You're going to need your ACH number, you're going to need your bank and your routing number and all of that so that the state is able to pay you. So very important to get that one correct. Next slide, please. Billing information, service location, service area, what areas you're covering. The state grabs this information to the system so they can say, okay, we've got services in Jamestown, but we need more services in Minot or whatever. I'm just giving you examples. Mailing addresses, billing numbers, and then your EFT information. All of that's important. Yes. It's attached to the agency provider and associated with a tax ID. You wouldn't want to use yours. Yeah, Gabe, that's exactly true. When I say yours at this point, I'm talking about agencies. I don't mean Gabe's personally. I mean Nexus Path, or I think I mixed your agency, MTC. That was your agency. So when I say yours here, I'm not referring to I'm not referring to Gabe's or Marcello's. I'm referring to your agency's tax ID and EIN. So thank you for that. Next slide, please. This is the group affiliation. This is, are you part of any other larger group? Are you connected in any way to the other NPI or services here? Most of your agencies count kind of small and smaller, and you're not connected to sort of a big health system, et cetera. So you might not need to do this as well. Next slide, please. Next slide. This is that. All right. Oh, from the previous slide, just if you have other Medicaid ID numbers, you're letting the system know my agency already has these Medicaid ID numbers. We're getting a new one to do 1915I services. So the state can link all of those records from the agency. Next slide, please. Thanks for going back in, Bridget. Electronic transactions, how you're going to do this. So this is where you tell the state, and this is part of provider enrollment, you're going to have an idea about how are you going to collect data on and information on what work that you're doing and how are you going to bill. Paper claims, I think, are still a possibility, but everybody's walking, not doing paper claims as much as they can. Some agencies are gathering information on spreadsheets. We'll have some examples of spreadsheets you can use to do this work, etc. Agencies, larger agencies may have billing systems or electronic health records, etc. And that's where you need to get to enroll as a provider. You need to get information from that process. If you are already part of a larger health system, I'm thinking back again to the Wendy, I think it was you who were from Sanford, etc. You're going to need to know how your agency does this and gather this information in order to get enrolled, if that's your plan as being a 1915I. You will need different information. If you were submitting it directly into the web portal, you're collecting it on a spreadsheet and then you're entering into the web portal. If you're using vendor software, if you're using a billing agent or you're using a clearinghouse for this work, the portal is then going to start to ask you for that. Monica, you want to jump in and talk about therapy and the billing possibilities through therapy?
Yeah, I just wanted to mention that I know some agencies already have like a third-party billing software or use a different agency or organization. We will be, we've just dipped our toes into using Therap Services, which is our online documentation system right now. We're just using it for that care coordination and creating the plan of care. But we'll be expanding on that. So providers will hopefully sooner rather than later have the chance to use Therap for billing rather than going into MMIS, which is going to be a dramatically less cumbersome process for everyone. So we're looking at, making the changes we need to make, and we'll be offering that to providers as part of their, provider oversight account that they have at no charge. So that'll be a really nice,
That's very important.
Yeah.
So that's great. And is there any timelines for when, I know the agencies are thinking this, is there any timelines for when Therap will be in place for that? Thinking about how it fits in with agencies' work plans and timelines.
I am kind of the optimistic one of our group. I want to say hopefully within about the next 6 to 9 months that we'll have that ready to go for the providers to use. That I don't have an actual timeline, but that in my mind is where I want that to fall. Yeah.
That's great. That's great. Okay. I've got also a question in the chat from Gabe. He's asking, if we're providing services under one company, under one agency, but at multiple locations, would you apply for one NPI or an NPI for each location? That is very much an agency decision. I will give you the pluses and minuses for each. It is cleanest and, shall we say, most facile if you get all the numbers right, for it to be a separate NPI for each different location, each different office, not like each different home where you're delivering services, but each different location. That's really the cleanest and the simple. Your system is going to have to be able to connect this NPI with this Medicaid number so that it goes on to this claim for this service. But if you can do that, then there isn't confusion among different addresses and locations. Yeah. Yeah, Monica, jump in here.
Yeah, so I would recommend just doing one because then you only have to do the enrollment process once instead of 5 to 6 times if you have 5 to 6 locations. Most of our providers right now have only done the one, and you do provide them with a list of your service locations when you fill out the provider checklist, which is the second part of the enrollment process.
So what we've seen, the reason I was saying something different, and again, it's agency decision, is that what we have seen is that agencies have put different addresses on the claims with the one NPI number, and the Medicaid ID has one address that's attached to one Medicaid ID and one NPI. And if those 3 don't match and aren't linked in the North Dakota system, then the claim will get rejected.
Yeah, which is why they provide provider enrollment with a list of their service locations. So they're all linked under that NPI.
Yeah. Okay. Oh, you've been able to fix that. We've seen a number of other states where they've not been able to, they're like, you got to have all the addresses fixed.
No, we have one provider who has, I believe, 9 or 10 different service locations associated under their one NPI. And that's working great.
Good. Okay. Then follow that.
What
Just
I'm
wanna make
hearing
sure
you
there's-
say though, is you gotta make sure those addresses are like, I assume they're gonna have the same scrutiny on the addresses that are associated with the provider. That
Yep.
they are exact, when you submit the claim, it's exactly how we have it set up when we submit our license.
Right. Yep. That's correct.
So that's what I'm hearing is that's one of the challenges is you have to have that exact. Okay, thank you.
They all have to match. Yep, exactly. All right, thanks. Good conversation. All right, so next slide, please. Can't wait for Thera. Okay, we went through this. Okay, next slide, please. So ownership. So for agencies that are not for profits, this is not something that you need to do, but you're going to have clicked back in the system and said whether you're a for-profit or a not-for-profit. If you're not for profit, you're going to have your nonprofit tax ID number and give the state that information. If you're a for-profit, you're going to have to complete these screens related to ownership. Next slide, please. Look at me the details. That'd be a little bit bigger so that I can see. You're going to have to answer questions 1 through 5. You're going to answer information in regard to the ownership. If any of the owners of your business own, I believe the number is more than 5% of your business, each of those names need to be checked annually and against the Office of Inspector General at Health and Human Services, the exclusions database, and we'll have a link to that somewhere in that process. You're going to need to give information, including Social Security numbers for all managing and director employees as well. The biggest challenges we've seen for agencies is when these processes, they look for Social Security numbers, both for the nonprofits, they're wanting information on your board. For the for-profits, they're going to want that information on your owners. That's something people often may not be used to, et cetera. That's a federal requirement. North Dakota is not making that requirement. So just be aware of that as well. You're going to have to complete information about who owns, how much do they own, et cetera, to your business. The next slide, please. Authorized representative. So who can speak for your agency to the state? Who can change things? How do they do that? You want to get all of this information in because this is how the state knows how to contact you when things are changing. They will put you on if you're signing up as a North Dakota provider, and then anytime there's a new change in policy around the behavioral health providers, et cetera, and you're signed up as a behavioral health provider, you'll get that through that information. So this is why the state needs information on here. Again, we recommend maybe a generic email, one that won't be, if employee changes roles or leaves your company, et cetera, one that won't be lost there, because that's been a real problem for agencies. They're told, oh, the rules change, you have to do this now, you have to contact us now, and it goes to an email that doesn't exist anymore. Again, most of these systems are automated, so there won't be a human being at the other end that says, oh, Marcella doesn't work for CSH anymore, we should send this to Ambrosia. You won't get that. It'll just go into the void, and that won't be good for your agency. So yes, your authorized reps, next slide. Good. Pharmacist, that's not relevant here, so good. You'll get begins and end dates for that. Exclusions and sanctions. So this is all of a list of things that your agency can't have been excluded from, sanctioned by individuals who've lost their license. This is how make sure that quality services are delivered by quality professionals here. So there's a long list of there. Next slide, please. So yeah, so next slide, I just want to make sure I get through all of these before we go. Qualified service providers, we can skip this section again because there aren't licenses required there. Next slide. For other services, you can also use the slide deck because I hear a couple of you interested in other services behind the eye. And then you click submit, save and validate and submit. Next slide. You're registering for web access, that's optional, but it's highly recommended. They should give you a user ID, et cetera, for submitting the application. Click save and click validate. So next slide, please. Next step of submitting the application, you're giving them, next slide, please. Sorry, I can't see this. All right, claim submission effective date. This is going to give you your start date. Your enrollment with Medicaid will be effective. Claims will give you the claim submission date. Date can't be changed. This is a state determination based on when you submitted the application. North Dakota allows what's called retroactive enrollment, meaning they can enroll you as far back as 90 days. They can't enroll you back further. They can pay you for people who are approved for services as far back as 90 days as well. Or they may give you a retroactive enrollment date, but I don't think that's got to be 90 days.
1915I is a no for retro.
Oh, it's for retro. Oh, I'm sorry. All right, take back everything I said. Thank you, Monica. That's standard Medicaid, but it's often not in home and community-based services. So the state's not choosing to do that. So you can't be paid for services until the date at which you are approved. So if you get your Medicaid letter and your Medicaid ID says you're Medicaid enrolled, your agency is Medicaid enrolled as of August 1st, you may have done great things on July 31st, but you can't bill for it. So thank you. Next slide, please. So what are the PDF forms? What are they asking you to upload in all of this process? We'll take you through sort of some of the things you're committing to. So next slide, please. Cover sheet, this list of the forms here, group application checklist. If you're enrolling more than one services, you have service locations, you want a W-9, you want your tax exempt letter, you want your group attestation. You're going to need the printout from the NPSS website. That's the website where you get your NPI number. That needs to be included in your application. The state has a state form 661. That's your EFT form. They're going to want to include a blank or a voided check on that. Out of state, there's network enrollment clarification forms required there. If you're for-profit, the ownership forms, and then the basic request for Medicaid provider enrollment. Next slide, please. This is just a list of the cover sheet, basic information there. Go through this. Next slide, group attestation. Group application, talked about that. Next, because I want to get to next. And again, you guys can look at all this as possible. List of your service locations. Next, I want to get to this is what your agency is agreeing to. W-9, very basic for you. Nonprofit tax letter. Next, group attestation, as we talked about before. Next, I want to get to the NPI printout. That's just a look at what it looks like. Thank you. ET fund. Thank you. Next, bank voided check. Out of network enrollment form if you're out of state if you're out of state. Ownership control, we talked about that. Next, I want to get to, okay, so this is the Medicaid provider enrollment agreement. This is what I wanted to get to. There are a variety of things that your agency is agreeing to in this form. You're agreeing to adhere to all the Medicaid rules. You're agreeing to abide by HIPAA. You are agreeing to not discriminate based on any protected classes. You are agreeing to not commit waste, fraud, or abuse. You are agreeing to keep your records for 7 years. You are agreeing to allow DHS access to your records at any time, including audit. You are enrolling in, if you are enrolling, you want to click on here, Medicaid fee for service. So the folks that you're working with that are in the aged, blind, and disabled category, pregnant or parenting women, children, etc., they're mostly going to be covered by Medicaid fee for service. Any adults who are enrolled because of low income, without any disabling conditions, or at least disabling conditions the state's aware of, you are enrolling also as a Medicaid expansion. So this is an old form. This now says Blue Cross Blue Shield, but you're clicking on the box on the far right there as well. So this is setting you up in order to be able to build the different systems. If you're doing Medicaid fee for service, that's the majority of your population. If you're doing Medicaid expansion, that you want to make sure that you're allowed to be billing there as well. This state will be downloading information to Blue Cross on, usually it's a monthly basis, on what providers are enrolled, what they're enrolled to provide, and if you're submitting bills or claims to Blue Cross, they're going to need to have your information as well.
Can I just add to Marcella that providers are required to enroll both for fee for service and expansion for 1959 services. Good. Yeah, you can't choose just one or the other. Yeah.
Thank you. That's good to know and important. So yeah, so these are all the list: age discrimination, North Dakota Human Rights Act, Security Act, all of the different laws. And most agencies have no problems with doing that, etc. But we just want you to be aware what it is you're signing. So next slide, please. And we go through. You submit the forms. You can email them to North Dakota Medicaid Enrollment at noridian.com, fax and emails. Anyone on here done this recently? I've heard that there's been some delays. Noridian's kind of backed up, but I don't know how long it's taking for responses here. But I'd love to hear from anybody who's, Monica, if you've heard from providers, if any of the providers are aware.
I can attest to them being very backed up. Yes. I am in the position where they're trying to prioritize 1915I. So if I do contact them about an enrollment, generally speaking, I can get that moving right away. But yeah, if I think the key thing is to make sure that all of your I's are dotted, all your T's are crossed, that that application is as perfect as you can get it when you send it in. And that will eliminate any back and forth and any delays that come with that. But yes, it's a slow process. They're just trying to keep up. Yeah.
Any ideas on how long do you think it's going to be? Like, I mean, I'm sorry, like how, like on average, how long do you think it's?
I mean, I've seen it, like Shanika got their healing center one through really quickly, which I was like, wow. And that was without my help. Maybe that's the factor. Maybe I need to not be involved. But, you know, I've seen other ones where, you know, maybe it got stuck in the fax machine and someone else grabbed it, or, you know, there's different things where I've seen it take 4, 5, 6 weeks for the enrollment to happen. So really important to reach out to our team, to me specifically. I'm usually the one who deals with provider enrollment on a regular basis. We will be having a member of the provider enrollment team on our calls shortly within the next couple weeks too, to hopefully answer some of those questions, and also to kind of build that relationship with you all as providers, and to know that you can reach out to her and, you know, she can help things along too. So yeah, 2 to 6 weeks would be my estimate, but some I've seen take longer if there's issues with the applications.
Monica, this is Heather Semenich, but just to offer another perspective, unfortunately, I know you know this, but since we've talked, only one has come through. So we're pushing month 4.
Okay. Of
so
your
more
individual
like
enrollments?
16 weeks on individual enrollment.
So, but you didn't start the individual enrollment process 16 weeks ago, right? You started
Yes, yep. Nope, their applications were submitted at the end of April or the very first week in May.
For 1915I?
For 1915I.
Oh, okay. So, yeah, because I didn't even see their names pop up on my provider list as pending until probably a month and a half ago, I don't think.
Yeah, we would have all the documentation of the dates that they were submitted. So
okay.
We do have providers that have been waiting for nearly 4 months now to begin delivering any service.
Okay, so knowing that, and thank you for that, Heather, please reach out to me with that information if it's taking longer than you expect, or let me know when you've submitted and I can watch for those applications to come through my reports and make sure those pending statuses are changing. You know, I'll do whatever I can do to make sure that they move along as quickly as possible.
Okay, thanks. Sounds good.
Yeah, thanks.
Yeah. Monica, how long do you think, if they haven't heard back anything in 2 weeks, in a month, when should they contact you?
You know, I think 2 weeks is probably
great.
Probably a good time frame. Yeah.
Good. All right. Thanks, everybody. And thank you, especially Monica, for moving this forward. So next slide, please. I know that's a delay. So just a moment, any questions at this point? You guys have been jumping in with questions, and that's been great. Let's keep that up. I love this slide. That was so colorful. Okay, next slide. Just because we got about 12 minutes, I want to make sure we get info in. All right, we don't have time to do the breakout sessions here. Know that normally when we do these, we'll narrow this time a little bit more, etc. But we want to give your time, agencies, time to go back into your teams. We want you to take out the work plan, etc., and really start filling that out. Okay, I learned X. Who's working on this? Who's the lead? Who's taking this? What's our time frames there, etc. What tasks need to be added to your work plan? So next slide, please. We're not going to take that time. Maybe we'll get you out of here a little bit earlier. So we will have a lot of information here, a lot of details. Monica said we're going to have somebody from Meridian on. They're going to be joining us in future sessions. We'll definitely want them on Q&A. On Friday, we're going to get together at 3 o'clock. We'll be doing Q&A on the Medicaid Academy and just the whole process and provider enrollment. So any questions, anything that comes to you between now and then. And then session 2 is going to be next Wednesday, same time. We're going to talk about participant enrollment, how somebody goes from a person in community who has needs to a person who's receiving 1915I services with your agency. We're going to take you through all those steps of that process, who does what roles, what requirements are in place for this, what requirements are in place for agencies, what requirements are in place for individuals, what requirements are in place that DHS put in place, what requirements are required at the federal level. We will talk about the public health emergency and why It's important. Monica, correct me if I'm wrong. Did North Dakota request the waiver of the need for face-to-face assessments for HCBS under the public health emergency? Is
No.
that in place or no? No, so
No.
you're still requiring face-to-face. Okay.
Yeah.
So yeah, that's important to know. So again, all of these kinds of questions about all of these systems, please come back and join us. You'll be getting emails from Ambrosia during the week. She'll have slide decks. She'll be sending out the training and tools. And please, if there's any questions or any way we can make these sessions more helpful to you, that's what we're here for. So please let us know. So next slide, that may be, or am I at the end? So thank you. What else can be helpful to your agencies as you go through the process? Monica, anything you wanted to cover or raise with everybody?
No, I don't think so. Just, we appreciate y'all participating, and I really look forward to working with everybody. Please feel free to reach out to me directly with any questions or concerns you have with the enrollment process or with anything else related to 1959.
Yeah, we appreciate how available you've made yourself. Again, partly because these programs are so big and so complicated, you're just so lucky that DHS has, a full-time person on this and really figuring out what all the kinks are and making it work. All right, so we will see some of you, my guess is on Friday, if you want to join us. Again, not required, just there if you need us. And then otherwise we will be back in now for, we'll be back next Wednesday.
I
Oh,
see a
Heidi's got a question.
Heidi, is timely filing now 180 days? Yes, it has changed. I believe that's in effect now. It used to be a year and now it's shortened to 180 days.
Can you explain timely filing to folks who don't speak Medicaid? Clearly Heidi speaks Medicaid.
Yeah, Heidi could probably explain it better than myself, but that basically when we started 1959, which is my reference point, you could file a claim back 1 year. You had 1 year to file your claims. Now they've changed that to 180 days.
Okay.
I'm not sure what went into that decision, why it happened. I mean, to me, it makes sense. Why would you not want to get paid before a year's time? But yeah, that requirement has changed.
Yeah. So 180 days from service delivery. So if I'm getting services today, August 3rd, I have my agency has 180 days to file that claim and submit that claim.
Yep. Yeah.
And do we know, is it submit a clean claim that the MCO or the clearinghouse accepts, or is it submit any kind of claim and then the clock sort of stops? If they don't like, if we made a mistake on it, they ask us to fix it, we should still, my old MCO used to be, it's from when how do you interpret that?
I would honestly have to check into the logistics of that. I have a gut feeling, but I don't want to misguide anyone.
Yeah.
Yeah.
We'll check
we
on-
can
yeah.
share that. Yeah, we can share that later.
Okay. So yeah, when does the clock start for the 180 days?
Mhm.
Yeah, Ambrosia, definitely add that to our FAQ. All right, good questions, everybody.
So I just have personal experience on that. My personal experience has been once it's denied, you have to resubmit. But so I think the answer is no, you don't get a working period is my understanding, because I've had that happen where it was denied and then in another role, our office support didn't follow up on it quick enough. And then the time passed and then that was it. So.
Yeah, thanks, Lisa.
Yeah. We'll definitely, I'll just do a little double checking just to make sure we get the right information out. Yeah.
Good questions. Very sophisticated group. All right. Well, thanks everybody and have a great afternoon. And we will see some of you on Friday, some next week. Thank you for spending time with us and thank you for the learning and thank you for all the answers you bring to the table as well. So much appreciated.